everybody, welcome to my channel. Today we're going to talk about borderline personality disorder. I'm Rita and today it's all about you. Borderline personality disorder is a mental health disease that impacts the way a person thinks and feels about themselves and about the ones that surround them. For a person that has borderline personality disorder, it is really difficult to manage emotions, behaviors, and usually have an unstable pattern of relationships. The symptoms usually result in impulsive actions and problems in the relationships because there are an intense experience of anger, depression, anxiety that may last for hours or days and that affect the daily life relation with other people. And this doesn't have to be only intimate relationships, but also with friends, with family, and with acquaintances. Because this is an informative and educational channel, with no intention to diagnose any person or any situation in particular. And like always, I will give you a general view of the main symptoms of borderline personality disorder. Usually this disorder is divided in 4 groups of symptoms, and the first one is emotional instability or an affective dysregulation that affects moods, affects the way a person sees themselves and sees the others. Cognitive distortion, which means having a disturbed pattern of thinking and the way a person have a perception about the world, the situations and the things that surround them. Impulsive behaviors and, as we say before, intense and unstable relationships. In general, the main symptoms are fear of abandonment, having an unclear self-image, have a tendency to self-harm, emotional and extreme mood swings, often feelings of emptiness, anger and out of touch with reality. These symptoms of this personality disorder may range from mild to severe, and usually this starts or may eventually start during adolescent and teenager times and prolongs until adulthood. The main causes are genetic, the brain function and the brain structure, and social and cultural factors. So, in a way, this is a type of disease that can come from a traumatic experience, but also can come from an heritage from somebody in the family, or it can come from a malfunction on the brain. Usually the diagnosis is based on clinical assessment, of course by a mental health professional. And because the range of symptoms are wide, sometimes it's really difficult to understand what kind of disorder can be the right one to be diagnosed. Because it is very typical that a person with borderline personality disorder has also other type of disorders and mental health problems at the same time. And so the diagnosis is based on what the person can refer as a symptom and also by observation of a mental health professional. For a patient, it's really important to find a therapist that has borderline personality disorder experience and with whom they can trust and create a bond that will help the treatment to go further. In general, talking therapies are the ones with the high score on positive results for this type of disorder. But particularly the dialect behavior therapy and the mentalization-based therapy are the ones that usually therapists choose as the ones that are more benefit the patients with borderline personality disorder. And this happens because usually these two types of therapy, they are the strong ones in helping the patient analyze their own thoughts and understand and change the ones that are not real. In general, the psychiatric medication is not recommended for this type of disorder because there are no drugs that can influence the brain in this type of condition. Recovery, of course, will take time, but can eventually improve the ability to function and help the patient feel better and be able to deal with all the challenges of their daily life. And of course, there are always a better chance of success when the person or the patient has a support group that can really help improve their quality of mental health. And so that's all for today, guys. I hope you like it. I hope you subscribe to the channel. Leave a thumbs up, share with a friend, comment if you want, and I'll see you next time for another video. Bye!